Okay, thank you, Susan, so much. Good morning to you. You're there with your
Good
coffee
morning.
in Santa Cruz. Good morning. I want to just get it started. We're going to be talking about the Watsonville Community Hospital project that you were involved with, your community foundation was involved with. And before we get started, I just want to ask you, Susan, just to give a quick overview of your current role with the foundation. Maybe if you can highlight what the foundation's mission is, and maybe anything you feel that makes your foundation unique in what you do or how you serve your community.
Thanks, Kim. I'm Susan True. I'm the CEO of Community Foundation Santa Cruz County. I've been in the role for about 5 years. And what I love about our work is that our mission is to bring together people, ideas, and resources to both inspire philanthropy and accomplish great things. So it's a really broad mission in terms of accomplish great things. But what that means to us is that we have a real focus on getting things done for our community. And we're very solutions focused to make sure that when our community has a need, it gets addressed.
That's great. Sounds very involved in your community. So that's great to have you there helping the community. So it sounds like you do quite a lot of projects for your community, probably very diverse and different in every way. I know you had recently floods and various urgencies that come up from time to time. What are some of the projects that your foundation has been involved with over the past few years? You could highlight a
Yeah,
couple
well, we were
different.
sure. We do. You're right. We do a lot of different things. We were born out of some horrific floods in 1982 with tremendous loss of lives. And at that time, the community didn't have a central place to go to help their neighbors or a central place to collect and distribute resources in a time of need. And so we were born out of that need. And since then, we played a central role in the response and recovery to the COVID pandemic, to some devastating wildfires that we had in 2020, and now to floods again. So that's one thing, is being a quick responder to community needs. But the other thing is much more sustained and over time for pressing community issues. So we address long-term issues too in the community by bringing people together. We have this unique role where we get to hear some of the county's best ideas and put them into place by bringing people together, finding resources, and addressing things like youth wellness, educational opportunities, the well-being of seniors, healthcare access, water sustainability. We do a lot of different things for the people and places of this county.
Wow, that is incredible. I don't know how you divide up all your time in the day to do all those different things. So I'm sure you're very busy, no? So let's try to focus maybe a little bit now on one of your most recent projects, just to highlight to the people watching or reading the interview. Let's take a deep dive into the project on the Watsonville Community Hospital, which I understand was about to close its doors, I think, last year in 2022. Perhaps you could share some of the key internal issues that the hospital was facing. Why was it going to close its doors? And maybe what was going on before your foundation actually became involved?
Sure. Rural communities are losing hospitals all over the country. And we were about to be the next community in line to lose its hospital. And this comes following over 20 years of private ownership. So in 1998, the Watsonville Community Hospital was sold to a large out-of-state for-profit company. And at that time, the understanding was that the privatization of the hospital would actually bring needed resources to improve services. But that's really not what happened. And in fact, it became a period of great instability. So, for example, there was a revolving door of CEOs. Over 20 CEOs served the hospital in that period of 22 years. So all these different executives passing through, there's chronic inattention to basic operations, lots of lost profitability and missed opportunity. Finally, in 2019, a small limited liability company bought the hospital, and then they resold it to a real estate investment trust, a REIT, and then leased back the operations to the hospital. So we're getting into really interesting ownership structures. And finally, in January of 2021, the LLC defaulted on its lease, and the REIT replaced the board and the operator of the hospital. And a year later, the hospital was in bankruptcy. So it's, the level of chronic inattention, instability, really neglect, lack of leadership, kind of literally ran it into the ground. So,
Wow, that's massive.
yeah, it was really scary for us. And in some community leaders in the summer of 21, so prior to the bankruptcy filing, but aware that this was probably going to happen, our county government and the city of Watsonville, where the hospital is, and a community health trust, which is a conversion foundation from when the hospital was sold in the first place back in 1998, and our federally qualified health center, Salud para la Gente, all formed a project called the Healthcare District Project to take all the steps necessary to acquire the hospital. And they became the bidder. That project was the legal official bidder in the bankruptcy proceedings. So during that process of July to the January filing, it was really clear the extent of and severity of the neglect of the hospital. So just a total breakdown in billing and accounts receivable, total failure to negotiate insurance contracts, so very low rates for reimbursement, vacant space was unrented. And so looking at all of those factors of neglect, a business plan was formed to turn around the hospital. Like, if we can pull all these different levels, given the state that it's in now, all these different levers, can we have a well-functioning hospital? And so that business plan was developed to understand if it could indeed be a functioning hospital.
Mm-hmm. Wow, that is incredible. And it sounds like a lot of different moving pieces and various people involved in all of this, no?
Mm-hmm.
And it almost sounds like it's just too big a problem to even solve and even to get involved in, and maybe not directly something you've ever done before, I can imagine. So if, for example, just for us to understand, let's just say the hospital would close its doors, what would be the health impact and social impact to the local community? Are there other hospitals or centers for support? So I guess how urgent was
Yeah.
this, and what would happen to everybody if the doors were closed or they weren't able to continue as they were?
Yeah. Well, I think first I want to really address that point you made, that it was a really big problem. And the community foundation, the community foundation gets involved in problems that are too big for any one entity to solve on its own. So anything that requires a lot of people to come together to solve, we really like to jump in and play a leadership role to bring people together to make sure the resources are there. And so you're exactly right. This problem, no one entity could have solved on its own. And I think that's a really important point, because I'm really proud of our community and our community leaders who stepped in, put everything else aside to get this done. And the reason why it was so important that we all jump in is because we're a small county. We're under 300,000 people, about 277,000. And we do have 2 hospitals with emergency rooms, Watsonville, and then we have a nonprofit hospital, Dominican, in the northern part of the county. And they're only about 15 miles apart. So I can see on paper where somebody would say, well, that's not a big problem. But if you look at the traffic patterns in our community, we have traffic stalemate in the mornings going north and in the afternoons going south. And so in the morning, if somebody had an emergency, it could take an hour to get to the hospital from the Watsonville service area. And so that just felt literally like a life and death situation. The Watsonville Hospital emergency department is very busy. And I like to say, like, one of the things that really was a driver for me was that over half of our babies are born at Watsonville Community Hospital. I mean, that kind of gives you a sense of how necessary this hospital is in the health of our community. And our local health system, like many health systems in the United States, it's a fragile patchwork of payer sources, of patient care, of specialty care. And so this is a very important part of our whole healthcare system, is the provision of care at this hospital.
Yeah, I can imagine. And as you mentioned, just 1 hour of a drive could be too far. for
Mhm.
somebody that has urgent needs, right?
Yeah.
So that is amazing that your foundation has wanted to be part of this and saving the hospital and this big mission and issue, and also urgency. So tell us the scale of this financial need that you had to try to solve, or non-financial issues that you know had to solve, and
Mm.
very quickly. How did you tackle that? What was the magnitude of that financially? Because I can imagine it wasn't an easy
Yeah.
effort.
Yeah, like I said, I'm so proud of our community for being able to pull this off. And it really
Mhm.
took several different sets of expertise, skills, and high levels of initiative. The first non-financial issue was that the court required a new California healthcare district to be formed and to take on the ownership and operations of the hospital. And through state urgency legislation, our state senator, John Laird, in 19 days had that healthcare district signed into law by our governor. So to think that, the state of California, in the middle of,
That's amazing.
pandemic and climate change and budget issues,
Yeah.
like all the things going on, that, Watsonville Hospital in bankruptcy court in January, and by late February, we had a healthcare district formed. I mean, it's just like, just to be in the good fortune of having Senator Laird's leadership, where he could get that done. Not many state legislators would have been able to do that. He is uniquely qualified to be able to do it. So that came together beautifully. And then, of course, as I mentioned, the business plan was needed to address some core issues in the business. So billing and accounts receivable processes were broken, as I said, and so that needed to be addressed. What could be leveraged and thought to sustain and get the hospital into the operational black. I mentioned renegotiating insurance contracts, and then looking at all the debt, as debts mounted, as costs skyrocketed during the pandemic. So that was the non-financial part. But then we also needed to raise $67 million between February and August. We are a
Wow.
small community. So
Not
that
easy.
it is not easy. And to have a community commit to purchase its own hospital just doesn't happen. I don't know of this happening anywhere else. Um,
Mhm.
so our state budget dedicated 25 million of that 67 million. So that was an incredible feat as well by many of our state legislators who advocated on behalf of that large budget allocation for the hospital purchase. But that's still left. we still had to raise $42 million in just a couple of months under very tight bankruptcy timelines.
And you did it. You did it. No, the
We
is
did
operating.
it. We did it. Yep.
So that leaves me wondering. You have this hospital, very very tight time frame. I think you said 67 million that you needed to raise. A lot of other non-financial, a lot of other actors, a lot of other support. I imagine the amount of just even time, resources, and effort was overwhelming. Um, and yet, there's all maybe perhaps other smaller and easier high impact type projects in Santa Cruz County. Um, I'm curious to know how did you or your foundation really feel that they should give, or why did they feel they should get involved in something so enormous like the hospital, and dedicate your time and financial resources when maybe there was other, perhaps easier, high impact projects that were needed as well.
Well, like I said, our mission is to accomplish great things, and this is a great thing to get to be a part of accomplishing. And not something I know of has been done elsewhere, and something that I thought was our community was uniquely positioned with the leaders who chose to step up, uniquely positioned to succeed. And yet, it was a fragile process. I mean, it was an overwhelming load to take on. But I really felt like with the incredible leadership of Dori Rose Inda, who is the executive director of Salud para la Gente, our federally qualified health center, with Senator Laird, and with our county administrative officer, Carlos Palacios, I really felt like if the foundation got behind their incredible motivation and expertise to do this, that it would succeed. And I think leadership is all about, picking the winners, right? When do you jump in
Right.
to do something? Because without you, it may not happen. So this, I feel, is one of, the principal elements of my job, is to know when we need to resource big issues and come together to get something done.
Great. Thank you for walking through some of the steps of the process and for taking such a big initiative that maybe nobody else would have taken on or been part of. So I think the community hospital, probably the whole community, is very appreciative of your participation in that. Are there any specific people that you, or groups of people that you want to highlight in terms of leading the efforts, not only your community foundation, but you mentioned some other people. Is there anybody that you want to highlight in terms of their support in this project?
Yeah, like I said, the community came together, and so many. I've mentioned, I think, the three most important leaders in the project, but we played a very important role in fundraising, and I think it's important to note that people step forward with their wallets in a very risky proposition. We've all been sitting around watching this hospital fail for over 20 years, and so to put money into it is a leap of faith. And we had really incredible people dig through the business plan. Our board member, Kirk Schmidt, was quite instrumental in that. Driscoll's offered $1.7 million as a match, and we successfully raised that match. We had many donors come forward, and we raised over $7 million, the Community Foundation alone, in just a few months. So there were a lot of people who just got behind this idea that we had to get it done.
That's great. That's really great to hear the community putting such large resources in place for this. So I imagine not everything went super smoothly. Probably there was a few hiccups on the way, things that didn't happen exactly as you had hoped it would happen. I'm still very impressed, by the way, that you did all of this in such a short time period. But maybe you could share one or two of the hiccups that you had to try to solve to make this happen.
Well, the biggest hiccup came with the state budget. As I mentioned, the state had allocated $25 million in its budget to support the acquisition of the hospital. We were on a very tight timetable. We had to present the funds at the end of August in the bankruptcy court. And just before that deadline, about, I think, 10 days before, we realized that there was an error, an administrative clerical error in the state budget. And the funds that had been allocated for the purchase of the hospital in state budget language, which is law, was to go to the Watsonville Community Hospital. Now, the Watsonville Community Hospital entity was in bankruptcy court and is owned by a REIT. We did not want the hospital to get the $25 million. We needed the healthcare district that I had mentioned we formed to get the funds. And so our state senator had to create fix-it language for the budget. Imagine this is all happening at the state of California level. I mean, the scale of all the things happening is pretty tremendous. So Senator Laird worked on the budget language to fix this administrative error, but we still needed to have that $25 million accounted for. We were relying on it for the bankruptcy proceedings at the end of August. So we put together five $5 million loans in the community. So one came from the Community Foundation, and then the cities and the health clinic all pitched in. And so we created a structure to do five short-term $5 million loans to come up with that $25 million. And this is where we were really lucky that we had community capital advisors on board with us for years in advance, because I was able to just call Mark Rand and say, Mark, we have a crisis. We are so close to purchasing this hospital, but we have to find some really quick financing. And having that structure in place at a community foundation means you can act swiftly to create capital in all sorts of different situations, this one being very unexpected.
So that's great. So community capital advisors helped you through that process and through that hiccup, and were able to solve that short-term financing. So everything worked out in the end. There's a happy fairy tale story. Today, what's the current status of the hospital? Is it fully operational as before, or what's the status?
It's fully operational, and in a very sweet turn of events, several of the people that helped to get it to this fully operational place and community acquired have actually received care there. And I think it's meant a lot to all of us who have received care at the hospital in the period since the beginning of September, when we've owned it as a community. So that's kind of a sweet aftertaste to the whole thing, is that we truly are community members using our community-owned hospital.
Great. So with your help, and of course others, what changes have are made to ensure that now the hospital will be successful and that we can really hopefully rely on long-term stability going forward? I mean, obviously it didn't work out before, and there's a lot of operational issues before, as you highlighted. So how do we know that now we have it operational, really we can count on that being a long-term solution?
Yeah. Well, a couple of things. One is increasing revenue from the services that the hospital has already been providing, and that's really primarily through insurance contract renegotiations. Reduce the hospital's expenses to bring down the cost of care. There are many things that, again, had just never been renegotiated, from purchasing power to, so many different contracts that just needed to be looked at to bring down expenses. And then creating new revenue streams to better utilize the hospital's facilities. I mentioned that much of the hospital was vacant. So bringing back some of the cath lab, bringing back, having physical therapy, all sorts of different revenue streams can be realized by using the facilities better. And finally, we're helping to build fundraising capacity. The hospital, in being privately held these last 20 plus years, didn't develop, a community relationship or fundraising. And so many nonprofit hospitals do have a foundation, a fundraising arm. And so we're working to develop that to better supplement and improve the quality of care.
That's great. Yeah, I think it's very important to not only just save the hospital, but to keep it going sustainably in the long term. I imagine there's already been, and as you said, will continue to be, significant social impact to the community as a result of your efforts. Let's look at the patients and the clients of the hospital. How has this project positively or maybe negatively affected them before and now, the patients and the clients of the hospital?
They are unaware. They've had seamless operations, continued care, and no disruption. So we were not closed even one day. So there has been an absolute continuity of care for the community, and I think that's what we're most proud of.
It's amazing that there has been no impact on them. I'm surprised. So that's really commendable. So you mentioned that your foundation has never done anything like this before.
I don't think anybody's ever done anything like this.
Probably don't want to do it again. But probably there's been a few key learnings. So maybe to everybody listening or reading this interview, what are some of your reflections or takeaways? What would you maybe do differently next time if you had to do it again?
I think the hardest thing about the project is that, the community had experienced such neglectful management for so long that, over literally generations, you end up giving up hope that this hospital can ever be a well-functioning hospital. And I think that we should have done a better job earlier of explaining the complexities of the failure in a more simple way. And it should have been communicated, just much earlier and more simply, so that the public could see a path forward. Because I think that we would have, even though we did raise the money, and it's quite remarkable, it was hard. And I think part of why it was hard is we didn't have enough trusted community leaders who were doing the external messaging. We were also focused on the acquisition of the hospital and the business turnaround plan. that, it wasn't until much later that we're like, oh gosh, we should probably have an op-ed in the paper, and oh gosh, we probably need some news coverage about like the hope and the promise of the community-owned hospital, because I think many people just thought there's no way this thing can succeed.
Right. Yeah, I would have my doubts as well. I think everybody would be very impressed to hear this story for sure. So for projects like this, you've mentioned several times how the communities come together, all the different diverse groups and stakeholders that had to take part and help not only your community foundation, but many others to reach a common agreement. And you had to do it very, very quickly.
Mhm.
So do you have any tips for others that might be working on very diverse projects, trying to bring communities together, and building, any best practices you have, tips you have on building communications or the relationship with so many different perspectives and interests and trying to reach a common goal quickly?
The work of the hospital acquisition in some ways started decades before. And the reason I say that is because so much of what happened is we could operate quickly because we trusted each other. And so I knew that Senator Laird would do his job to the very best of his ability, and there was nobody better to do it. I knew that our county administrative officer, he and I worked on many projects in the past. I knew that he was going to make sure this got done, that he was going to use all of his municipal connections to make sure that this happened, um, and make sure that it was done with compliance with the law and put all the resources necessary into it. And I absolutely trusted Dory Rose Inda that she would work with the very best business analysts in the state on hospital financing issues to make sure that we had a solid plan. And the reason I knew that is because we have all worked together for so long on projects that benefit this community. And so, if we were all new to each other, I don't know that this would have happened, because it's just a lot to put on the line if you don't even know people. So I think the most important thing in thinking about a project like this that is so time sensitive and requires so many different kinds of expertise is that you're laying the groundwork for building trusted relationships with a diverse group of community leaders who are all able to impact the community in different ways over long periods of time. That's really how this project happened.
Yeah, and as you were talking before you said the word trust, I was thinking that was a very
Mm-hmm.
key word. Clearly, everyone has the expertise
Yeah.
and perhaps passion for their role that they serve, but it's that trust of connecting each other that you've built over time that made it easy to perhaps execute more
Yeah.
quickly. So, on a personal level, I imagine this was a little bit stressful for you, and I imagine some of the things that you're doing for the community can be uh, perhaps stressful or perhaps very urgent. So, how do you personally persevere and take on many of the challenges, these highly sensitive projects, urgent, financial, all the different players that are involved? I'm curious, how do you manage your day-to-day pressures and emotional aspects that clearly must arise during projects like this? So if you could provide any personal insights, that would be amazing.
We try to laugh a lot.
Right.
So I think that's the most important thing. And we have a great team at the Community Foundation. We have a staff that's really committed to jumping in and doing these things. The whole team is on board with making sure that we're serious. When we say we're going to accomplish great things, we're going to do it. And so people are willing to adjust workflows, change schedules, work with priorities. So I'm not doing this by myself. And we really have a great team of people that have a broad range of expertise, from understanding the community, understanding community issues, to understanding, our finances and how to put together, where to pull this investment from. I mean, we just have a really solid team. So trying to laugh a lot about the absurdities of our world and and working with great people.
That's great. Yeah, I think it's important, given the serious issues that we're facing, that we also can try to calm ourselves down a little bit. Like you said, laugh, try to get through the best way we can with working with each other. Based on your experience, then I'm asking for tips and advice all over the place today. But do you have any tips or advice for others who are working on social impact projects? I know it's very general, but or for those that want to get involved in very high social impact causes as you are doing. Do you have any tips or advice for people to really maximize their time and efforts and really start or do more of what they're already doing?
Yeah, I think it would be bold. There's an important gap to be filled in financing of important social impact projects. And what I see a lot is that there's sort of a replication of lending and grants to pretty safe projects. And I always think that the community foundation's role is to be the lender of last resort, because projects are so risky that nobody else wants to take them on, right? That's what the market's not going to do on its own. And that's what we're here for. We're here to say that has a credible path to a desired social impact. And without us, it's probably not going to get done, because nobody else is going to finance this. And that's what a community foundation is for. We're not a bank. We're about building community. And so I think that boldness has really helped us in this project to say, yeah, we'll just figure out 5 different groups to do $5 million loans. Like, we're going to just do that. And that's just, I think, has really helped us to do many great things. And I love the partnership with Community Capital Advisors, because Mark has been supportive of that profile of lending, but also really helped to keep us safe and make sure that there is due diligence and that we have really looked into what the risks are. And so any risk that we're taking is a known risk, and hopefully has some mitigating forces at work as well. So the partnership between Community Capital Advisors, I think, has helped us to do that bold action safely and well.
Great. And I think you partly answered this question already, but what advice would you, as to wrap up, what advice would you give to other foundations or funders or investors or donors? As you mentioned, this is pretty risky. So, maybe they're hesitant to provide the funding and get involved. Yes, they can be bold, but still it's very risky. So how would you respond to them when they're saying that they don't want to take on more risk? Or really, how can they mitigate some of these risks to feel more comfortable in providing support?
Not sure if I have an answer for that.
Okay, that's all right.
Because I mean, what I've said hasn't necessarily motivated people that I've spoken to about it. So it's an interesting, I think some of it is just a profile of a foundation, and how cautious, for whatever reason, a foundation needs to be. We have a board and a staff and a community that really demands action, and that we take stands on important issues. There aren't other community institutions here that can do what we do. And so the community asks a lot of us to do that. And I feel very responsible to respond to that. And I guess I always ask, who are we trying to protect? Is this, because if we're just here to protect ourselves, we're no longer relevant to serving the community. So we have to look out for our own interests so that we can continue to serve the community, generations down the line. But if that's where our analysis stops, then we actually aren't of service to the community in the way we're designed to be.
I think that's beautifully said, by the way. For to protect ourselves or our own risk or our own fears, then are we really a foundation or community foundation here to serve others, right? I think that's a beautiful summary for this amazing project and work that you do. So thank you for your time.
Sure.
And your transparency and providing us all kinds of insights into this project. And also thank you for your dedication and your passion.
Oh, thank you.
Your efforts. So that will be it for the interview today. So thank you so much, Susan.
Thank you.
Soon.